Okay, so we have a couple more people hopping on. So for those that are here, why don't you go ahead and introduce yourself in the chat. You can just go ahead and put your name while we're getting started. Okay, well, it looks like we have about 22 people, so I'm sure there'll be some more people that join us. But since we have a lot of information to get through today, we'll go ahead and get started. But again, just make sure that you're introducing yourself in the chat. So welcome everybody, and thank you for being here today. I know you had another training already today that some of you may have, not today, this week that some of you may have attended. So it's a heavy training week. So I appreciate you taking the time to be at this one as well. So today's training, it's best practices in data, serving customers with disabilities and collecting WIOA disability related data elements. And today's training is hosted by the LEAD Center, which stands for Leadership for the Employment and Economic Advancement of People with Disabilities. And for those of you who may be new to the LEAD Center, we are a Workforce Innovation and Opportunity Act or WIOA Policy Development Center. And the LEAD Center is led by Social Policy Research Associates and the National Disability Institute, and is funded by the Office of Disability Employment Policy and the U.S. Department of Labor. So just a little bit of housekeeping. So we are doing live captioning today. So if anyone needs that, we have some information here. So if you wish to personalize captioning, you can click the live transcript button on the Zoom panel to find the hide captions option, or adjust caption size under the subtitle settings option. Alternatively, you may open a captioning web page in a new browser, and we're going to put the link in the chat right now. So if you would like to use that one instead, you will be able to use this link here that was just put in chat, and you can adjust the background color, text color, and font using the drop down menus in the browser. And for participation today, if you want to turn on your cameras, that'll be great. It is a small group, so we would like to be as interactive as possible. If you prefer to have them off, that's fine. But if you have questions or want to speak, if you can turn them on, that would be really great. If you have questions at all during the presentation, you can either raise your hand, and then when you're called upon, you can unmute. You can just unmute yourself and ask a question, or you can type your questions in the chat box. We will have some designated time for Q&A. So if you want to hold the questions, that works. But if you want to ask while we're going through it, that's also fine. Just want to give a little introduction to myself and Jesse, who will be doing the training. My name is Dallas Oberle. I am a senior associate with the LEAD Center at Social Policy Research Associates. And we have been working with Carrie and Susie to help develop this training for you all. They're participating in a pilot that's really focused on connecting WIOA partners and looking at disability related data elements associated with that. So after some going through an assessment and having some discussions of what might be the most beneficial for frontline staff, we pulled together some training that really focuses on those required WIOA disability related data elements, and then some best practices that we thought would be helpful for staff. And I will turn it over to Jessie to introduce herself.
Hey everybody, I think it's morning where you are. Good morning, my name is Jessie Ettinger. I'm based in Portland, Oregon. So it is early where I am, and hopefully my kids will be out of the house in the next 10 minutes and you won't hear from them. But I'm also senior associate with Dallas at SPR. I've been working on the LEAD Center project for the last few years. I'm a big fan of WIOA, and I'm excited to be here. And one of my favorite things is dropping in on local agencies and hearing about implementation issues, whether it's sort of the nitty gritty stuff about data entry or it's promising practices. And so I've done my best when going over my script to sort of pare back my comments, but I visited probably over 50 AJCs over the course of my time at SPR for various site visits. And one other sort of fun fact about me is I am the WIOA one-stop operator for the city and county of San Francisco. So I do spend a lot of time with that board and all of those providers and their WIOA partners trying to parse through some of the stuff on the local level. So anyway, I'm delighted to be here today and to talk about these Pearl elements, and I'll do my best not to wonk out on you too hard about some of this back-end data when it comes to DOL, because that's another pet project of mine. All right, so that's it for me.
Okay, thanks, Jessie. And I guess I jumped right over some of my background, which I should provide as well. So prior to working at SPR, I worked at an AJC in Michigan. That's where I am located for about 14 years. So have a lot of experience working at the one-stops, working with the WIOA partners and collaboration. So I have a lot of background knowledge that goes into that. So again, I'm happy to be here, and we are going to start off by just launching a little poll for everyone to answer. So really, we want to get to know you and how familiar you are with the required WIOA disability related data elements. So I'm going to go ahead and launch the poll. So if you go ahead and pick so the question again, how familiar are you with the required WIOA disability related data elements? And your answers are anonymous, so feel free to answer as honestly as you can. Options are very familiar, familiar, somewhat familiar, unfamiliar, very familiar, and I don't know. So it looks like we're getting a lot of somewhat familiars, a couple that are familiar with it, and some that don't seem to know a lot about it, which is fine because we're going to go over it in a lot of detail. So you will learn a lot today about it. So great. So it looks like a lot are somewhat familiar. So I think we're on the right track with putting together this training for you all to help you learn a little bit more about these required data elements. Okay, so I'll go ahead and end our poll. That way you can see what some of the answers or responses were. Okay. Okay, so just a little overview of some of those training objectives for today. We are going to go over all of the 10 required WIOA disability related data elements in detail, so you'll be more familiar with it. We also have some best practices that we are going to go over. There's some tip sheets we're going to share, go over some disability etiquette, and some medical confidential information. The recording and materials will all be available after the training, and you will notice throughout the slide deck that there are links that are embedded to the presentation for resources. So once you have that, you'll be able to click on all of those links to access those resources that we're providing. Okay, and I'm going to turn it over to Jessie for the next section.
Excellent. So before we dive into those 10 elements, I think we wanted to ground this training in some context and just sort of some ideas, and there's sort of two big ideas. One is that this is about what I hope is a goal of everybody on this call, which is to be providing better services and making our AJCCs as high quality and responsive to customers as possible. And so, the good or high quality, those are fairly subjective terms. And so we're going to ground that, like that sense of high quality in the USDOL has provided some guiding hallmarks of excellence, which we can apply to serving customers with disabilities. And I have to say, in California, they have 8 hallmarks of excellence. So like we're scaling back to 3 here. We're going to make this a little simpler. So the 3 hallmarks of excellence are the needs of businesses and workers drive workforce solutions, and local boards are accountable to communities in which they're located. That one-stop centers or American Job Centers provide excellent customer services to all job seekers and employers and focus on continuous improvement. And that the workforce system supports strong regional economies and plays an active role in community and workforce development. So what does that mean specific to providing excellent customer service to folks with disabilities? First, the AJC should reflect a warm and welcoming environment to all customers who are served. All AJC staff are courteous, polite, responsive, and helpful to job seekers, businesses, and anybody else who visits the AJC, and that staff are sensitive to the unique needs of individuals with disabilities and prepared to offer necessary accommodations. And at the end of the presentation, we'll go over some disability etiquette and some best practices, just some tips for making sure that staff and managers who are working with your staff, like what that means to be courteous and welcoming and do that right. I know there's oftentimes a lot of insecurity about doing that correctly, so we have some tips at the end. Second, AJCC, or I keep saying AJCC because in California their branding is AJCC, which is very confusing. But AJCs should provide meaningful, and I am really trying to place the emphasis on meaningful. Just having a ramp to get into your center is not meaningful access, and we'll talk about that in a sec. But meaningful access to both the physical space and the programming for all customers. So in terms of just the physical accessibility, thinking about what I was saying earlier, having a ramp is a great first step, but physical accessibility goes beyond basic ADA compliance. And it's really about making sure the physical space is welcoming, navigable, and easy to use for all of your customers. And so, thinking about things like universal design for learning or human-centered design, if you are in the position to be revisiting the physical layout of your AJC, sort of thinking about how you could also incorporate signage, like pictorial, written, verbal, tactile modes, making sure that people with different kinds of abilities or strengths are able to see and navigate and view all the resources that you have. That includes customers who have English language issues, customers who have physical disabilities moving around a space, people who might have intellectual disabilities and might need help. Maybe they can't read really well. So just thinking about all of the possible use scenarios and making sure the center is a welcoming space for as many people as possible. And I'm going to try really hard not to have all these asides about things that I've seen in the field, but one best practice that has always stood out for me is a few years ago, I visited an AJC in Spokane, Washington, and they were in the position to be sort of remodeling their AJC. And so part of that was they invited a lot of different customers in to come in and consult about what a comfortable space would feel like, including a lot of people with different kinds of disabilities. And so again, getting back to this ADA basics, it's not just about having the ramp and the wide doorways. It's about talking to people about what's really comfortable amount of space to use a wheelchair. It's having desks with varying heights. It's having quiet spaces for people who have sensory processing disorders. It introduced a much broader array of fairly simple things they could do to make the space feel comfortable for everyone. And then in terms of programmatic accessibility, again, it's thinking about are the programs and services that we're offering, can anybody participate, or as many people as possible participate? So that's important piece of accessibility and offering access. And then the last sort of tenet that we wanted to bring up is including both virtual and center-based service delivery for job seekers, workers, and employers. Both methods of delivery support talent needs for the regional economy. But as we found out, some people, first of all, I just want to give everybody in the country kudos for really ramping up their virtual services over the last few years. And I think part of that process really showed us that there are a lot of people, one, where it's easier and it makes it much more accessible to have a lot of high quality services online. And for folks that maybe couldn't make it to the AJC or felt medically compromised to go out in public, having those virtual services was excellent. But the other thing that we've heard from the field is that there are a lot of people who virtual services don't work for them. And so still continuing to have that brick and mortar presence, to have that one-on-one customer service is really important. So building up both of those things. So I feel like I've already gone way longer than I was supposed to on this slide. So next slide. The other big picture that I wanted to paint before we dive into these elements is why we collect this data. I mean, it's required, so that's one reason why we collect it. That's important. But multiple agencies and organizations serve participants under WIOA, and collecting those common data elements across the various partners enables us to learn who's being served by which agencies, and that allows us to enhance collaboration among required and non-required partners. So it can help with expanding partnerships at the state level and the local level. And then it also, I think, is helpful to frontline staff. The more information you have about the people that you're working with, the better and more tailored services you can offer. So really, this is about better information. It's better information for the frontline staff, better information for your state and local partners about who's being served, and maybe what sorts of leverage or synergy you can come up with at a local area. And then again, I'm going off script for a minute. I tend to bring this up when we do trainings on performance. Dallas and I and a bunch of our colleagues, we actually have a lot of contracts with the Federal Department of Labor, where we're working with that team and pulling data out of the big system about what's happening. And I think maybe what sometimes gets lost is, at the maybe state, at your local agency level, you're putting information in asset. It's going essentially to DWD, and they're sort of pulling information out about what's happening in Wisconsin, and then they're feeding that back to the federal folks. And all it is it's data. It's like these big files of data. And so if you're at DOL and you're trying to figure out like what's going on, how do I make a funding decision? How do I make these policy choices? A lot of times they're relying, maybe overly relying, they're relying on the data that's in those systems. And so they're trying to pull it apart and unpack what's happening. And particularly with people with disabilities, we believe, and I think this is true, that folks with disabilities and the services that they're receiving are being undercounted. I think in part because maybe it's because they're not receiving services at the AJCs. That would be a really important thing for folks to know. Or maybe they're being undercounted because it's not clear to everybody what sorts of services they receive or how to ask them about their disability. And so in either case, like that's really important information for policymaking and for funding. So I always tell folks, like, you're sitting there doing data entry, and I've been on the other side. I know people are seeing that data point at the other side, and it does get through, and it is important. So those are some of my big picture, like, yes, it's important. Like, let's get excited about these elements. Okay, so next slide. What do we record? All right, so this is a segue. We record disability status for all participants. And while voluntary, all participants have the opportunity to indicate whether they have a disability. If participants indicate that they do have a disability, you should record whether or not they're receiving these various services from other partners, getting back to like, how is this integration happening and to what extent? And I'm going to say this many times over the next few slides. If somebody says they have a disability and then we're following up about what services they use, you cannot leave it blank. If you leave it blank, you're indicating that person doesn't have a disability. There's always an option to say, no, they did not get a service from that partner. So that would be the option to choose. Like, yes, they got the service. No, they didn't get the service. Don't leave it blank. I think that's sort of the most important takeaway here. And then the other important thing to add here is that you can update this status over the course of working with somebody. And again, disability is a sensitive topic, and it's not always well understood, like what is a disability and what isn't. So as you're working with somebody, they might feel more comfortable and disclose to you that they do have a disability, or you might be talking and realize that they have a qualified disability but that they didn't disclose it to you because they didn't know that that was something that would count. And so if something comes up and you find out over the course of working with an individual that they have a disability, you can go back and update all of this. And that's why you have this and all of that information, and that's why you have it as a medical and disability supplemental form. And that form, this is the form where all of the Pearl disability elements are on. So, and it's different and distinct from the participant eligibility and enrollment form. All right, so that's it for the my overview. And then Dallas and I are going to start trading off. We're going to walk through those 10 elements. So Dallas, you're going to get started, I believe.
Yep. Yep. I'm going to take over and start the first of the data elements. So I just want to, before I switch to the next slide, again, this medical and disability supplemental form, all of these data elements that we're going to go over, they're on this form. So you're collecting the information, but we're going to talk about what they mean and some resources, as well as what it looks like in assets. So you know that you're selecting the right option for the individual you're working with. So the first data element, which is the one that you're probably the most familiar with, the one that you feel like might be the easiest to enter, though we'll talk a little bit in the disability etiquette, but sometimes you might feel funny asking somebody about a disability. So we'll just talk a little bit through that and some of that disability etiquette as well. But the first one is to identify if the individual that you're working with has a disability. So they would indicate, yes, they have a disability. No, they do not have a disability, or they choose not to disclose. That is always an option. So an individual can say that they don't want to tell you yes or no, and that is perfectly fine. And you can record it as that. And then just to define disability, it's the definition from the Americans with Disabilities Act. Is a physical or mental impairment that substantially limits one or more of the person's major life activities. So that's one that the first one to ask, and that kind of drives a lot of the rest of the questions that you have to ask. So these are the options in asset. And again, you can say, yes, they have a disability. No, they do not, or the individual is not disclosing, or it's unknown. So the next one is to, if the individual indicates that they have a disability, then you should choose the type of disability. And there's going to be a list of 7 different categories. And then just to know, individuals may choose all of the categories or 2. I mean, they can choose more than one. They don't have to just pick one. And it's important that the customer self-reports and that staff don't make assumptions about what the disability may be. For example, if a career coach or case manager observes a customer coming in a wheelchair, they should not automatically select physical or mobility impairment unless that customer states that they have an impairment related to mobility. So on the next slide, we'll go over what the 7 categories are. They can be, and again, they can pick multiple ones of these. It's physical chronic health condition, physical mobility impairment, mental or psychiatric disability, vision-related disability, hearing-related disability, learning disability, or cognitive intellectual disability. And then the individual can also choose not to disclose. So they might say, yes, I have a disability, but I don't want to disclose what type. And that's fine too. That is an option that you can select. And if in that first question, they say that they do not have a disability, then here you would select no disability. You shouldn't leave this blank at all. It should be filled out that if, in the first question, they do not have a disability, you select no disability. If in the first one they say they have a disability, then your option is to pick one or more of the 7 categories, or that they do not disclose, so that there's always an option and never left blank. And again, if you have any questions at all, feel free to add them to the chat. We will have some Q&A sessions as well, so you can hold them till that point if you prefer as well. So the next thing we're going to do a little scenario activity. We're going to have you break into small groups, and I'm going to pop a link here into the chat. So when you get into your small groups, oh, it ends up being a long link because I did it as a small one here. But you'll be able to click on the link. You'll get into your breakout groups and you're going to read through the scenario. You're going to have about 10 minutes to do this. And the scenario is about a customer named Bob, who is directed by vocational rehabilitation to seek services at their local AJC. So I want you to discuss how you would handle the scenario. In the scenario, it provides 3 different answers, but also provides some feedback, which gives some guiding principles that correspond with each of the answer. So I want you to talk about that scenario, the different answers, and then how you would handle it. And if you've had a situation come up that you want to share of how you've handled something similar, we'll do that as well. So Jesse's going to break you up into groups. Again, we're going to give you about 10 minutes to do this, and then we'll bring you back. And then we'll just do a couple minutes just to share what you discussed. And if anybody has a specific scenario that they've experienced that they want to share, that would be great as well. So Jesse, just let me know when you're ready.
I'm ready, and I'm sending you all to breakout rooms, and I'll send you a 60-second warning when it's time to come out. And obviously the caption does not need to go to the breakout room.
Okay. And I know, so Jesse, Caleb, I don't know if you guys want to hop into some of them, maybe give them a minute to get started, just to make sure they don't have any questions.
Yep, I'll go one by one.
Okay, I'll start from the back then, and so I'll start at room 5.
Okay, I'll start at room 1.
Okay, I'll stay here in case anyone pops back to the main room.
Okay.
Hi Dallas, this is Janelle the captioner.
Hello.
Did you want me to stay here in the main room?
Yep, you can stay in the main room.
Okay, I got moved, but then I got moved back, so.
Oh, I think she realized that you were the captioner and you didn't have to go into one of them.
Gotcha, thanks.
Okay, I am going over to 4.
Okay, thanks, Caleb. Hey, Jesse. Caleb just popped from, or popped back in and went to room 4.
I was muted. I'm gonna head over to 2. In room 1, I think they were still just reading the scenario. I might stop in on them in a minute.
Okay.
So Dallas, one thing I'm seeing is that it's pretty quiet in a lot of these rooms. Should I actively try to facilitate, or should I just continue to be a fly on the wall? Like, I think folks are just sitting there staring at the scenario.
Yeah, I guess if nobody's talking, maybe add a question to get them talking. Thanks.
Mhm. Right, Dallas, it looks like, should I give a 1-minute warning now?
Sure.
Okay. Okay, it looks like Kayla made it to room 3, and Harry's in room 1. So I think we're probably covered.
Okay. Good. Oh. All right, I'm closing the breakout rooms. Okay. Looks like people are starting to come back. There's still about 30 seconds, so people are wrapping up a little bit. Okay, so we should have everybody coming back over to this room with us. And we'll just take a couple minutes just to see if anyone wants to share what they talked about, either about the scenario that was provided or about a situation maybe that you've encountered or a scenario that you have. If you would like, you can just unmute and share.
I'll share. On our group, we had the scenario, the individual who disability was hard of hearing. And I believe, I can't remember if the person was also classified partial deaf, but we were just talking about how much disclosure and how much do we really need to ask of an individual, and not making that presumption a third party needs to know the person's situation. So the example we talked about that was brought up was when we're working with training providers, and then we have business services. So if we have an individual that comes to us hard of hearing, and then we're connected with business services, is that something that we need to talk with our business services manager, that we have an individual with this particular disability? But it goes back to, as the case manager, what are your conversations you having with that participant to better engage with the participant's permission? Does another third party need to know of that person's disability as a volunteer? Versus when you're talking with a training provider, we want to avoid those biases or those judgments that, well, this individual's not doing well because of, it would disclose they have a form of disability, but not by the participant, but by the referring agency, such as, with WIA. So we just talk about that. Sometimes an individual can think they're doing the right thing and just sharing some information. However, we still go back to the participant leading that direction. It may be just the participant will say, Yes, I do need the employer to know that I'm hard of hearing, but I'm a great lip reader. So the person may need to, like a heads up, talk a little bit slower. If they're in training, it's a different, how is the training format? If it's in person, it goes back to that one-on-one conversation, but not volunteering without the permission of any extenuating circumstances. Employers have on their application, is there accommodations or disability? That's where that comes into between the applicant and employer. So that was our scenario. We just got to be mindful of not overthinking that we need to relay a person's disability, thinking that it's in good gesture, but then it could also be a backfire situation.
Mm-hmm. Yeah, you make some good points. I mean, you want to make sure that the individual is able to disclose if they want to, but they also, to be able to, as staff, be able to talk to the individual about why it's helpful to disclose in certain situations, so they can get accommodations with a training provider or an employer. Yeah. Anyone else want to share before we move on?
One of the things I had shared is that it kind of goes back to what Jesse was talking about creating a welcome environment. And we just purchased, because we just returned to masking. And so we just purchased some open window masks for our front desk and for anybody staff that may need them, if they need to provide, if somebody needs to read lips for whatever reason, we have them available. So that kind of provides that welcoming environment.
Yeah, that's great. Did you guys do that previously, or is this for the new mask?
It's actually we've been working on it for a while, but yeah, we just implemented it.
Yeah, that's wonderful to be able to provide that.
Oh.
Okay, anyone else want to share? If not, then we'll go ahead and move on. But if you feel like you want to share something in the chat, that'll be great too. If you don't feel like unmuting and sharing something, feel free to add it to the chat. And I think we'll be passing it to Jesse for the next section.
Yep. So we're diving back into those really specific elements, those questions that you would see on that supplemental form. Sorry. Okay. And the first element asks whether or not the participant with a disability has received employment or other services funded by the State Developmental Disabilities Agency. It's a little bit of a trick question, so we'll get into it. But first, definition of developmental disability. So developmental disabilities are a group of conditions due to an impairment in physical, learning, language, or behavioral areas that began during the developmental period that may impact day-to-day functioning. So most developmental disabilities began before birth and last throughout a person's lifetime. So some examples of those might include attention deficit hyperactivity disorder, autism, cerebral palsy, muscular dystrophy, and it's not like a total rule of thumb, but generally these are conditions that folks are born with and that stay with them throughout their lives. So that's a developmental disability. And just sort of like another note about some of this. So obviously WIOA is federal legislation and it's talking about different kinds of services or agencies, but every state has its own constellation of how they distribute those services. So some states group different services under different agencies. Some states like split things apart that are together in other states. So they sort of do their best to use the vaguest terms. And so the State Developmental Disabilities Agency, there actually is not a singular State Developmental Disabilities Agency in Wisconsin, but the Wisconsin Department of Health Services does operate aging and disability resource centers. So in this case, when the SSDA, we're talking about ADRCs, or the Aging and Disability Resource Centers. So in Milwaukee, if you have a customer who has disclosed that they have a disability, you should ask them if they've received services through the ADRC. And some of those services might include options or enrollment counseling, services for youth in transition, information and assistance, disability benefit counseling, or referral to abuse and neglect investigation resources for risk adults. So next slide. When you are in asset and you're answering this question, it's a three-parter. Yes, they have received services through ADRC. No, they have not received services through ADRC. And if you leave it as unknown, undisclosed, that means that the person does not have a disability. That's the answer for someone who doesn't have a disability. But if somebody has a disability, this is not something to be left blank. And if you, if somebody doesn't have a disability, it's unknown. And the other two are binary, yes or no.
So,
Oh, sorry.
I just have a
somebody
quick
want to add
question.
something to that?
So
Please.
a lot of times I find that people just put unknown, undisclosed because they may not know if they receive services through the ADRC or not. But it sounds like the only way you should use that in this question is if they don't have a disability. So if I say learning disability above and I select unknown, undisclosed, that's technically incorrect, right?
I think that's right. And I think the answer, I think that what this is triggering is like, you should be asking this person if they've had services through the ADRC. And if you did not, you have not completed the questionnaire. But I
But what
like
if they don't know? Like we have a lot of
Yeah.
youth we work with that
Mhm.
they may not know.
It's a great question. Carrie or anybody else from, I don't think anyone from the state is on, or Dallas.
Yeah, I think because I think with this one, it's a lot of people maybe don't know because you're asking it as a state developmental disabilities agency, which there isn't one. So that's confusing. People probably don't know because they're asking it. And I just realized my camera wasn't on anymore because you're not asking it as an agency they would know. So I think if you're asking it as an agency, they would know. They would know that if they've gone to the ADRC. So it'd be either yes or no. And I know we have Caleb here with SPR, who's also works quite a bit with the lead center, but unknown, undisclosed should be if they do not have a disability. The point is that we don't want to leave things blank because that doesn't help, because it's hard to know like what the response was. Did you ask the question, or is that why it was, or was it left blank because you didn't ask the question?
Yeah.
So we want to at least be able to have something entered in so we know that they've been asked. And so that you know, and this is the guide just to help you know which one to put. So if they don't know, if you ask and they're like, I don't know if I've received services, I would put no, because at that point, they're not telling you that they have received a service.
Okay, that helps.
Ideally for these services, hi, everybody. If I haven't said hi to you yet, I said hi to some folks in breakout groups, but I'm Caleb. I work with Dallas and Jesse. Ideally, if somebody does not have a disability and you've already on that first question indicated, no, they don't have a disability, these other options in theory don't need to show up. They don't need to exist. I think currently in Wisconsin's asset system, they still show up. They all show up. And so if somebody has already answered, no, they don't have a disability, then the unknown or undisclosed is the right thing to do because you haven't specifically addressed it. I'll confirm that answer, and then we can follow up via email with the state.
Yeah, and this is actually the direction moving forward on a lot of these next questions. So I think the upshot is you should be asking everybody these very specific questions as part of filling out the form. And if they say they don't know, there's some prompting you can do in terms of being familiar with what these services would have looked like. And if you're still not getting anywhere, it's probably no. And so but we will follow up with some specific guidance there. But I think the goal here is that nothing is left blank when we finish this form.
Yep. And I would just add that. So we have tailored this so that we're pulling the answers that are in asset. Every state has a slightly different system that asks questions differently, and some have different responses that don't necessarily correlate with the actual required answers that are part of the PEARL, which is the participant individual record layout, which gives that direction to ask these questions. So it gets a little confusing because everybody's system looks a little differently. And as Caleb had mentioned, ideally, if they indicate no, they do not have a disability, then a lot of these questions you wouldn't even have to answer, but in some systems, you still have to answer them. So just want to make sure that at least you're clear on, okay, your system has you answer them still. What do you put if they do not have a disability? We don't want to just leave things blank.
Yeah, just to clarify, in asset in the state system, if you say no, those questions supplemental don't pop up.
Okay.
If you say yes, they do, and then there's choices for like no response. So is that unknown or no response? Like they don't, you know?
Yes. Yep. Okay. Thanks, Susie.
Yep.
Yeah, and I will not take this moment to explain like what all of these files look on. All of the files that come out of all of the states have to look uniform. And there's this whole code book, and it's very boring. I won't get into it, but it's actually a very interesting, complex problem. So you are participating in, again, creating good, high quality data sets when we participate in this. So let's move on to the next one. Next slide, please. All right, so the next question asks whether a participant with a disability has received employment or other services funded by the local or state mental health agency, the LSMHA. And this is a case where the acronym is not doing us any service compared to the title. They're both long. But the short of it is, in Milwaukee, the agency that this is referring to is the county's behavioral health division. So you're asking folks if they've received services from the behavioral health division in the county. And some of the services that so just sort of more about those services, some things that they might say that would trigger this connection would be that they've received services around substance abuse or mental health treatment, prevention, detox, inpatient or outpatient, care management, recovery support, including things like anger management, supported employment, or parenting assistance. So all of these things could be services that they received through the behavioral health division. And again, when you're getting to asset, they really are looking hopefully for that binary yes or no, and that you've really talked through it with the customer such that you can answer that question. But as we talked about, that can be complicated, so we'll follow up on that. All right, next slide. All right, so again, so this next slide asks whether the participant with a disability has received services funded by a state Medicaid home and community-based services waiver. So the Wisconsin Department of Health Services operates several programs under these HCBS waivers. And some things that you might want to look out for include the family care program, the family care partnership. I think one thing that seemed to come up a lot that maybe would be the most common scenario is you'd hear about IRIS. That counts as the HCBS or the Children's Long-Term Support Waiver. So in general, states can develop community-based service waivers that meet the needs of people who prefer to get their long-term care outside of institutions, but instead in the home and the community. And so generally, these waivers and programs apply to people who are 65 and older, physically disabled people, adults and children with developmental disabilities, and medically fragile people. So, so that's the definition of the HCBS program, and some things to like that might trigger that would be IRS and some of these other programs. Next slide. And again, it's similar to the other ones. We're really looking for that binary yes or no, and unknown, undisclosed would trigger does not have a disability. All right, next slide. Okay, so one of the things they ask about is whether or not folks have received, like if they want to know about the employment experience of people with somebody who has disclosed a disability. And specifically, they ask about whether or not an individual has been engaged in competitive integrated employment, group supported employment, and a work center or sheltered workshop experience. And so we're going to talk through what all three of those things mean. So we're going to start with competitive integrated employment. WIOA defines CIE as either full or part-time work, including self-employment, in which an individual with a disability is paid at or above minimum wage and located in an environment where the individual regularly interacts with people with both disabilities and not disabilities. So competitive integrated employment is like a regular mainstream job where somebody is being paid competitive wages and they're working in a normal work environment, or not normal, that's the wrong word, but they're working in a mainstream work environment. And that's where things are moving. That's sort of the gold standard. In 2017, Wisconsin passed Act 178, which requires that the Department of Vocational Rehabilitation, the Department of Health Services, and the Department of Public Instruction collaborate with stakeholders to come up with a plan to increase competitive integrated employment in Wisconsin. And in early 2021, they published some guiding principles. And the upshot there is that this is really the best scenario for most folks. It's good for the employers, the other employees, and the individual themselves to put them right into that work situation in day one, working with employers. And this idea of maybe transitional employment or putting them in a sheltered space and then hoping that someday they move into a mainstream work environment, that's no longer the model, but that really they want to increase the level of people in competitive integrated employment. And when you get the slide deck, there's links to all of these things, including those guiding principles, which provide a lot of the rationale for why it's important for that to be the goal for most folks with disabilities. So if you're talking to somebody who's disclosed that they have a disability and you're asking about their work history, some basic questions you can ask yourself, or sort of a little test you can do when you're considering whether something was competitive integrated employment is the two pieces of it. Competitive. So that means that the individual with a disability is earning the same wages and salary as a similarly situated individual in that organization. So that's the competitive part. And the integrated part is that the individual with the disability is using the same entrances, the same bathrooms and workspaces as the individuals that they work with. And I think this is another key part. If it's a job where there's a public facing role, that they're not prohibited from engaging with the public due to their disability. So those are some tests to ask yourself about whether or not this was in fact competitive integrated employment. All right, next slide. All right, the second work setting we're going to talk about is supported employment. So supported employment is employment, a real job with real pay or competitive integrated employment in an integrated setting. So it's like CIE plus. So, and it's really for individuals with some of the more significant disabilities. And so it's saying, well, they're in this competitive work environment, they're being paid fair wages, but that they have a case manager or a coach, either on-site or off-site, that's really helping them to persist and be successful and maybe troubleshoot issues that come up along the way. The most common model of supported employment is called individual placement and support. So if you hear of an IPS program, that's supported employment. And IPS is a proven supported employment model that helps people with mental health and substance abuse disorders find and keep jobs of their choosing. So if you have an individual who has disclosed that they either have mental health issues or have struggled with substance abuse, and that they're have a job that somebody is helping them, it's probably this IPS model that would count as supported employment. But it's based on, and getting back to maybe some of this competitive, why CIE is a preferred model here. Employment is treatment and it leads to improved recovery outcomes. So when working, people with mental health and substance use disorders often feel better about themselves, and their job role improves and their self-esteem improves. And it just sort of like that job and that satisfaction of moving towards self-sufficiency really does a lot to support some of their other goals, even if they're not directly employment related. And so again, when you get the slide deck, we have some nice links and resources about IPS programs that the Department of Health Services run, and it's a really interesting model. But the upshot to both of these programs is that competitive integrated employment and support really can help folks stay engaged and successful in their work. All right, next slide. So this is the third work setting that you would be asked about. And this is sometimes called a sheltered workshop or a work center. And what that means is it's usually a private, nonprofit, or a state or local government institution that provides employment opportunities for individuals that are developmentally, physically, or mentally impaired and prepares them for gainful work in the general economy. This model is being phased out. We sort of talked about that earlier, but originally I think the idea was that we put folks in these sheltered environments, give them some vocational skills, and hope that that was the bridge to competitive integrated employment. And I think sounds like that's being phased out. And the reason for that is it's maybe not a great practice to isolate people with disabilities, and that instead, like, introducing them to work and their coworkers like right away is a better model for persistence and long-term outcomes. So anyway, you might still see instances of that, and you could record that. Some things that would trigger that would be that they're making wages that are less than minimum wage or less than an industry standard. That might be, and that they're with other people with disabilities and not interfacing in an integrated environment. So some of those things might trigger that this is actually a sheltered work or work center experience. All right, so next slide. All right, so then we come back to asset. What are our options? We've got working in competitive integrated employment. So formally employed in supported employment, working in group supported employment, working in a sheltered workshop, 2 or more of those listed, or not currently employed. And again, there shouldn't be a no response, because either somebody is working or they're not working. And like, we have some options for what that work experience is. And there might be multiple things to choose from here. So again, this is not something to be left blank, and that all of these options should cover possible scenarios. But I know every time I say something like that, somebody brings up a case that is not covered, and we're left with a corner case. So if anyone from the state or Dallas or Caleb has more on that, we can talk about that as well. But I think that should cover the work setting questions. All right, next slide. Oh, yeah, sorry, I did cover that. That was the last slide. Now it's break time. I read my notes incorrectly. Dallas, tell me a little bit about that break.
So because it's a 2-hour training, we like to try to build in a couple minutes for you to stretch, use the restroom, grab water. Because of the time, we'll probably just give you about 5 minutes. So it is 11:06 at your time. So let's come back at 11:11-ish, and we'll get back started. That way you can have just a quick break, grab water, use restroom, or just stretch if you would like. Okay, we'll give everybody just another minute or so for the break, and then we'll get started on these last couple elements and into the best practices. Okay, it is 11:11. We'll go ahead and keep moving on. I hope everybody was able to get a good stretch in and move around. I know it's hard to sit for 2 hours straight, especially since I'm sure some of you had meetings right before this, and we'll probably have meetings right after. So nice to be able to move around just a little bit. We're going to go in and start talking about the last couple elements. So the next one is customized employment services received. So just wanted to also flag that I think Jen from DVR is on. So if there's specific questions for DVR during the Q&A, the next Q&A portion, we might turn to Jen for any questions that might be relevant for some of these services that are offered through DVR. But customized employment uses an approach called discovery to identify the strengths of an individual in community settings. The role of the service provider in customized employment is to facilitate customizing a job for the individual that matches their strengths as well as some of the business's needs. Customized employment is an option when typical supported employment strategies have not been successful, or when customized employment strategies may be more successful when to meet a customer's individualized support needs. So for this element, you're going to be talking with the individual to see if they've received discovery assessment services. So this is an assessment process to find out really who a person is and to determine the elements that are crucial to a person's employment success. It usually includes a variety of activities, including interviewing the individual and people who know them well, such as family, friends, or some staff that they may have been working with, as well as observing the individual in a different setting, maybe doing some typical life things that they would normally do. You're also going to be looking to see if they've had a developed customized employment search plan. And this uses information learned in that discovery assessment to help develop a plan towards meaningful employment, determine a list of potential employers, and maybe conduct an analysis of benefits. You'll also be looking to see if an individual has received employer negotiation services. So this is when either a job seeker or maybe like a business services staff or a career coach on behalf of the job seeker has negotiated accommodations with an employer on behalf of that job seeker with disabilities. Also looking to see if an individual has secured unsubsidized employment as a result of receiving some of these customized employment services and or extended support services. So in ASSET, again, you can select discovery assessment services, developed a customized employment search plan, employer negotiated services, the secured employment as a result of the CES services. And then you can also select not having received customized employment services. And the only time you should be having a no response is if they do not have a disability. So again, if they have a disability, you need to be selecting something. You can't be leaving this blank, because again, it doesn't give good data and information if we're leaving things blank if somebody has a disability. The next one is financial capability. So you're going to be looking to see if an individual with a disability has received benefit planning services or a term that it's financial capability or asset development services. So benefit planning services are services that help individuals who receive public benefits, such as SSI, which is supplemental security income, or SSDI, which is social security disability insurance. So to helps them understand how their benefits may change when they obtain a part-time or full-time job. I think we've all heard the term benefit cliff, and this is definitely where it plays in. If somebody is receiving benefits and they're not quite sure how much they can work before it kind of messes with some of their benefits, that's where some of those benefit planning will really help an individual. The financial capability and asset development services, that's really like financial literacy, financial management, things such as, opening a savings or checking account, understanding your credit score and debt, how are they managing personal budgets. So these are all kinds of things that fall under that financial capability and asset development. And then just want to provide you with some agencies that provide some of these services in your area. So Department of Health Services, they have a disability benefits specialist. These specialists will help adults with disabilities answer questions and solve problems related to their Social Security, Medicare, Medicaid, health insurance, and other public or private benefits. The ADRC, the Aging and Disability Resource Center that Jesse had talked about earlier, they also have benefits specialists that can do some of those same things of helping individuals with disabilities navigate their benefits. We have DVR has work incentive benefit counseling, and they can assist customers receiving Social Security disability benefits and public benefits move towards self-sufficiencies. These services address questions or concerns related to work and earnings, help customers navigate their benefits, entitlement, and economic assistance programs. And there's also the Social Security Administration's Work Incentive Planning and Assistance Program. And this is designed to help provide information and support for individuals that are receiving benefits and they want to work and really need to know how the employment will affect their Social Security benefits. So that, again, you're not getting that benefit cliff of working too much where they're losing some of the benefits that they have. And so in asset, you can select benefit planning assistance. So again, if they're working with somebody to help them understand their benefits and working, that financial capability, so some financial literacy, financial management, they can be getting both. And then you can also select not received financial capability services. And again, if they have a disability, you should be answering one of those or providing one of those as an answer and not providing no responses, only if an individual does not have a disability. And then I would recommend if somebody says that they've not received any of these financial services and they have a disability, really looking at some of those resources that we provided in the previous page that might help them really understand their benefits and working with those benefits. And then the next two elements that we're going to talk about kind of shift into education. So they're a little different than the other ones, but they're still included in these required WIOA disability related data elements. So this next one is the individual education program. So I'm sure many of you have heard the term IEP, and that is what this is referring to. It's asking if an individual with a disability either currently has an IEP or formerly had an IEP, special education services while they're attending school. And so the definition of an IEP, it's a plan used to ensure that students with disabilities that are eligible to receive special education and related services under the Individuals with Disabilities Education Act receive those services tailored to meet their unique needs in the least restrictive environment to prepare them for further education, employment, and independent living. So to be eligible, the student generally must be between the ages of 3 and 21, have a qualifying disability that would impact their educational performance. And some of those qualifying disabilities are autism, deafness, emotional disturbance, hearing impairment, just to name a few, but there's a list of 13 that would qualify for that qualifying disability. So in ASSET, you would be entering if they currently have an IEP and attending school. So again, those are going to be for some of the youth that are currently in secondary school. For people that have completed secondary school, you're going to be asking if they formally had an IEP and being able to select that. And then if neither of these apply, so if the individual has a disability, but has not had an IEP before or currently do not have one, then they would select that. And again, if they do not have a disability, that's the only time the no response would be allowable.
Hey, Dallas, as
Yes.
long as we were on, oh, you're about to cover it.
Oh yeah, I just saw Jen's question about 504. Yeah, so 504 is this is the last disability related data element, and it does have to do with the section 504 plan. So again, it's asking if an individual has a section 504 plan, and these are plans that provide students with disabilities reasonable accommodation from public schools or colleges. So again, it's part of the Rehabilitation Act. So it's really seeing if they're being able to provide that accommodation for individuals with some of those qualifying disabilities, and really trying to outline how the individual specific needs will be met through accommodation or modifications to services for them. So again, the answers that are available are yes, if the individual has a section 504 plan, no, if they have a disability but do not have the section 504 plan. It's Jen, since you asked that question, I don't know if there was anything that you wanted to add to either the IEP or the 504 plan.
No, I mean, I don't think so. Just that they exist. You can ask about it, make sure that you're capturing that information, or someone has a disability. There's a possibility that they had one of those in high school, even if they're quite a bit older. So
yeah, great. Yeah, thank you for adding that into the chat. So that is it. Those are the 10 required disability related data elements. So I hope that we were able to provide some clarity on what some of those meant. And so we're just going to take a couple minutes if there's any questions that you might have on anything we talked about. Since Jen is here from DVR, if you have something that you want to specifically ask about a service for DVR, that would be great. And I see that Carrie has a hand up.
Yeah, one of the things I wanted to ask related to the 504 plan is that I've been told that while somebody may have a 504 plan when they're in high school, once they go into a college or a tech trade school or any of those, it doesn't follow them. So they would need to ask the Office of Disability Services. They need to reach out for any accommodations. Is that correct?
Well, I will turn that to Jen to see.
Yeah, that's very correct. So, and it's not just the 504, right. It's the IEP as well. So high school planning and what works, it's really good for folks to understand what's been working well, what hasn't been working well. And then when they're preparing and when they've, kind of been accepted into a school and they're moving through that process, it's very important for folks that have a disability where they feel they're going to need an accommodation to continue to do well in school to reach out to their accommodations department right away. They're going to ask for documentation of the disability. Sometimes the IEP can be used for that. Sometimes it can't. So it's a whole process they need to work through. So it's important to start that early and get that conversation going.
Great. And I asked that so that our staff that are our career planners and things that are working with individuals that are moving into that, that college setting or that technical, they're taking classes at MATC or wherever that they may have to have the conversation because they may not know.
Great, thanks, Carrie. Thanks for asking that. That was a good question. Does anyone else have any other questions? Okay, if anything pops up, feel free to add it into the chat too, so we can address it. So now that we're done with the data elements, we're going to move into best practices, and I'm going to turn it over to Jessie.
Great. And you guys are probably sensing it. We're getting close to the end. We're not done yet though. So we do have some best practices to share and some fun resources. So the first thing we wanted to share that's coming your way are some tip sheets. And I have to be clear, I did not develop these tip sheets, but I use them all the time because I find them very helpful. And there's two of them. One is like a WIOA reporting tips or disability related elements one. And I think that one is probably going to be most useful for front end staff. We also have a Pearl tips for disability related elements. It's been mentioned before, and it's probably not super relevant for this training, but the Pearl is the participant individual record layout. And so every quarter, DWD looks at asset, they go to asset and they extract a file called the Pearl, which is then uploaded into the federal WIP system. And that is how USDOL eventually sees all of your outcome data and all of your progress data and the information about your participants. So anyway, there's some real specifics around the profile, making sure it lines up with all the required fields and can be uploaded correctly. So those are the two tip sheets. And they're helpful in terms of providing definitions and providing the specs. So those will be shared with you, and I think they're a great go-to resource. And then the next thing we wanted to do, and this sort of introduces our best practices, is we're going to share a short video, and it's really nice. It's only like 3.5 minutes, and it covers pretty well all of the best practices that we're going to bring up afterwards and highlight. So I'll let Dallas show that.
Good morning, Bob.
Morning there, big man. Morning, Alice! There's no need to be awkward.
Poor Bob. Like so many of us, he just doesn't know how to interact with people with disabilities.
It's pretty easy, really. People with disabilities are people first.
We need the same things that every person needs, like respect.
Good morning, everyone.
Attention!
Okay. Maybe we need to be more specific.
The easiest way to show respect is to focus on the person, not the disability. It's okay. You'll get the hang of it.
One easy way to focus on the person is to watch the person signing and not their interpreter.
Or their companion.
It's really cool that you'd like to help, but do us both a favor and please ask me first. What you think might be helping?
I got you.
Wait, ah! Oh no, might actually not.
If you'd like to offer me help, let me hold on to your elbow. Don't take mine.
Hey, would you like to take my arm?
Sure.
Assistive devices help us to live our lives. They're really important and really personal.
Grabbing them only makes it weird for everyone.
What?
Please only touch our devices and service animals if we've given you permission. And don't take it personally if I ask you not to. Remember that my service animal helps me all the time. Neither of us would like it if we were separated.
Remember, we make our own decisions. We sign documents, vote, volunteer, work, and pay taxes.
We get married.
So don't underestimate me just because I have a great smile.
Just because I'm blind.
May I help you?
Does not mean I'm deaf.
Just because I'm deaf doesn't mean I'm blind.
And just because I use a wheelchair doesn't mean that I can't sweep you off your feet.
So take a deep breath, relax. We don't bite.
Unless we're really hungry.
Hello there, ladies. How are you?
Hello. And if you're not sure what to do, just ask.
Hi, would you still like to see a menu?
No thanks, but can you please read it to me?
Sure, definitely.
Just treat us the way you would want to be treated, and we'll all be okay.
All right, that was a really nice opening. I don't even know if I need to read through these slides, but I'll just sort of recount some of the more important takeaways from that video. So the first one, getting back to providing excellent customer service to people with disabilities and all folks, is to treat everyone as a valued customer and don't treat people in particular with disabilities with pity or disrespect. And I think people might lean more towards over solicitousness that might come towards pity, but just try to be cool. Just treat them like they're a normal person. Learn about accessibility features in your AJC. So like if somebody calls and says, do you have a wheelchair ramp? Do you have an elevator? Just sort of being prepared to sort of say, yeah, I know how somebody could get into the building through various means. And also how to use assistive technology devices. This came up in our small group, but I feel like, and I don't know about your AJCs all specifically, but in my sort of broad review of AJCs and my review of many WIOA plans, I think there's this, the baseline is that when we think about AJCs being accessible to people with disabilities, it means that staff know to call VR if somebody with a disability walked in, and that's not good enough. And so there are lots of promising practices where just being aware of what kinds of screen readers you might have on your phone. I know a lot of people, at least in a small group I dropped in on, were really well versed in how to use a language line, how to get an interpreter on the line. That's awesome. And so just sort of keep expanding your knowledge base of things that are available. I was interviewing somebody the other day, and her whole job for the state that she works in, or her local workforce area, is to go around and train different AJCs on the kinds of assistive technologies that are available. And so, you know, where possible, just sort of learning more. And then getting back to maybe that example I gave about Spokane, when you're looking at your space, making sure that there's a clear path of travel for people using a mobility device, whether it's a walker or a cane, or they have a service animal, or they're in a wheelchair, that the spaces between desks from room to room, that they're wide enough to accommodate people who need that space. All right, next slide. Just sort of a mobility device is considered part of an individual's personal space. And so we saw an example of that in the video. Don't move somebody's walker out of the way, or their cane, or their wheelchair. Don't lean on it, and generally don't touch it unless you've asked their permission and sort of consider it part of their body. Like, it would be weird to touch somebody inappropriately in a meeting, and it's also weird to touch their assistive devices. And when you want to offer assistance, wait for the individual to respond. Don't make assumptions, listen, ask for instructions, and definitely respect whatever direction that they give you. Next slide. Speak directly to people with disabilities, and don't avoid eye contact or speak to their companions. And so again, the video did a nice job of showing that. I think this is particularly hard. I know I struggle with this too, that when you're talking to somebody who is using an interpreter, a sign language interpreter, it's easier to look at the person talking. I think that's how our brains are oriented, but be focused on the person who's signing. They're the ones communicating, and the interpreter is just sort of is helping, but the person, the communication is really coming from that person signing. And again, when somebody is with a companion who might be more able to speak on their behalf, or is, you know, for stature reasons, more at your eye level, again, like, try to be focused on the individual who you're assisting. Be patient and give your full attention to persons who have difficulty communicating, and some people need more time to express themselves. Again, I think this can be really challenging. I know that as case managers, you guys are so busy. You have these huge loads of clients and you're seeing a lot of folks. But just knowing that it takes some people a little bit longer to communicate, that's an important best practice. And this is really hard for me because I am definitely somebody who will like nod and smile too much. But if you don't understand somebody, don't pretend that you do and ask questions to help you understand. Sometimes it helps to have a coworker join the conversation and sort of get another person in the room just to help make sure you're understanding things correctly. Next slide. When speaking with a person who is deaf or hard of hearing, speak clearly, face the person, and don't cover your mouth. If you're speaking through an interpreter, direct your attention to the individual with the disability and not the interpreter. And so again, it's what we were talking about earlier. It can take some like cognitive retraining, but focus on the person you're talking to. I know I struggle. I talk too fast. You guys know that. You've just sat through a training with me. But slow down, make sure folks can see your face and give them the benefit of being able to read your lips and being able to see your expressions and all of those other nonverbal communication pieces that come into talking. When you are, another tip would be keep a paper and pen handy for exchanging notes with persons who are deaf or hard of hearing or have speech disabilities that affect their communication. So again, some folks might have a hard time communicating with you verbally. And so another great tool is to be able to communicate with people synchronously, but through a pen and paper. And there could possibly be other aids at your AJC that help with that. All right, next slide. When speaking with customers short of stature or a person using a wheelchair or scooter, it may be helpful to sit down at eye level if possible to make the conversation easier. And so this is where it's nice, and Caleb, I invite others and Jennifer to weigh in on this. I think it's a better practice to find a place where you're sitting as opposed to kneeling in front of them. I think that sometimes some people find that like a little patronizing. But yeah, try to find a way for you to have a natural conversation where you're able to make eye contact. When you're speaking to a person who is blind or has low vision, identify yourself and others who are with you so that you're helping orient them to the context of the room, and let them know when you're leaving. It's also important to use specific words to give information or directions. So if you're pointing somewhere or if you're referencing something with like a gesture, they probably can't see that. And so just making sure that a lot of what you're trying to communicate is coming out via words. And I'll pause very briefly. Like, I don't know if Jen or Dallas or Caleb, if you want to add anything to some of those tips I just provided, or if you have any sort of nuances, I definitely welcome other thoughts on best practices.
I would just go back to what Carrie had mentioned about the masks with the clear over the mouth. So that would be very helpful for, I think it was on the previous slide talking about, making sure that you're not covering your mouth. I mean, obviously right now everyone's wearing masks, so it's really hard to not cover your mouth when you're speaking to someone. So I think it's really great that you guys are getting those clear sections on the masks.
And I suppose I would just, at least for this particular slide, folks that are using a wheelchair or short of stature or whatnot, I mean, I think it's a little bit odd to have a conversation with somebody, even if they don't have a disability, but they're sitting and you're standing. In general, just with people, it's more ideal when possible to kind of have an equal level face-to-face interaction. And so making that possible especially when you're in conversation is good. When interacting with folks with low vision or people who are blind in particular, I find it sometimes helpful to interact with somebody in the same way that I might speak with them on the phone. Because when you're speaking with someone on the phone, they can't necessarily see your surroundings around you. And so if you were just, talking to someone on the phone, you would actually explain what you're doing rather than using the over here, over there terms, like nondescript terms to describe things. So.
Thanks. That's helpful. All right, next slide. And I think we do have time for more questions and comments too. So if others have thoughts on this, we can talk about those shortly. Before we leave, I would be remiss not to talk about a really important part of when you start talking to people about disabilities, which is you enter this whole new realm where you now have medically sensitive information about people, which requires a certain additional layer of protection for their private information. So, and I hope I get this right. Carrie is here to correct me and answer questions as well. But there are two forms. You have your participant file that you're keeping and your sort of eligibility and enrollment file, which is covering a lot of the basic information, which also goes into asset. And then you have your Employee Milwaukee Disability Supplement form. And so that's the information where all of this disability information is kept. And we want to treat this one separately. It goes in a separate file in a separate location because it has more sensitive information. And we're really dealing with a whole new world at that point. So your eligibility and enrollment information does not contain medical information. And while you're filling it out, I don't know if there's a lot of options to do this, but don't include any medical information in it because it's being treated slightly differently. You should fill out a Milwaukee Disability and Medical Supplemental form for everybody, regardless of whether they have a disability. So it's not like a special form just for the people with disabilities. It's everybody gets a participant file and everybody has a confidential file with this supplemental form. Additional forms that you should be thinking about are veterans and eligible spouses have a priority of service verification form. So that's another thing to keep in mind. And any information that involves a medical condition or a disability that could disclose a disability needs to be treated, especially in this confidential file. And then one more note, if medical information is not pertinent to their involvement in the program, don't collect it. Like they could tell you stuff and you might, that may be interesting or helpful context for you as a case manager, but if it doesn't impact their ability to get a job or complete training or be competitive in the workforce, don't write it down. You don't need to. So that's sort of the end of my notes. Carrie, do you want to add anything to that or expand on that?
Sure. So we just did a technical assistance on this at our career planner meeting on May 17th, but did want to reiterate a couple things. One is an additional form that needs to be kept confidential is a selective service form, because there is a question on there, and if we took it off, it would have hurt the integrity of the form. So we needed to leave that on, but that's going to need to be placed in confidential. Also, when this information is put in and uploaded into asset, those are the documents that Jesse just talked about. Those need to also be made confidential when you're uploading them. The other thing too that we've noticed is mostly with our youth programs, is if an individual is using an immunization record as proof of ID, that's going to need to be kept in a confidential file because that's medical information. So, while it's not a form, but it's something that you're collecting, that's going to need to be kept confidential.
Great. And I think now looks like we have about 15 minutes left. What's next in the run of show is Q&A. And I feel like we have a pretty broad approach to this. If you have questions about the elements, now's the time to ask. I still sometimes the disability etiquette stuff triggers questions. And I just want to emphasize, we didn't say this at the beginning, but this is a safe space. I hope that we are all sort of keeping each other's really well-intentioned questions in confidence. So if there were questions for the audience about situations where they were unclear about maybe the best practice for serving somebody with a disability or any of these etiquette questions, at least us on our team, like we're really trying to create an culture at our own office and in spaces that we're where it's okay to ask questions, especially if you're well-intentioned, and sometimes somebody else probably has the exact same question and might be embarrassed to ask. So feel free to bring questions about the etiquette or any of those elements. And we have a big team of folks here who might be able to weigh in.
So again, feel free to add it in the chat or unmute. We want to make sure you guys have plenty of time to ask questions. We don't want to end it short if there's some burning questions that you have.
And Caleb put something in the chat, which I think is important too. If you have best practices or a scenario you think your AJC dealt with particularly well, and you want to share that best practice with other folks, I think that would be also really beneficial to the group.
One of the things that I think is that I picked up along my travels and monitoring is having a signage, or even having like if you have a video screen that's constantly going, that one of the slides or one of the postings just states that, you know, accommodations are available to individuals upon request at no charge. But just to have that, that's going into that welcoming environment. So I usually try to recommend that to any of the places that we're monitoring.
Yeah, thanks for sharing that, Carrie. Definitely helpful for people to know that if they need an accommodation, it's not a cost to them. So you want to make sure that people aren't asking because they're worried that they aren't able to afford anything like that. So that's really great to have that. Anyone else want to share anything?
Something I thought of along the way, I just thought I would raise is, you know, if folks have ever run into a situation where, say, a customer indicates they do not have a disability, but then you learn that they are receiving some service or something like that that would only be available for somebody with a disability, what would you do? I don't know if anybody's ever run into a situation like that, but
Anyone have any thoughts for Caleb for this question?
I haven't run into a situation like that, but typically, because sometimes you know, we have case notes in the systems, and sometimes we can see other people's case notes. Sometimes in that reading other case note, you can kind of get information, and if that does happen, probably asking the client if they have one. And kind of going back to that scenario we had earlier is you know, having that discussion and probably kind of reiterating how that information will be used, that we keep it confidential. Sometimes it might be because they don't want to disclose that at the beginning, because they don't want us to use that against them. So just kind of going back to reiterating what, the importance of that information and how we're using it.
Yeah,
that's good. Go ahead.
Oh, I'm sorry, go ahead, Caleb.
Oh, I was going to say that's good. And just one little caveat I would add to that is, you know, if there are case notes that indicate somebody has a disability, even though they haven't disclosed, first of all, that should be in a protected file. It should not be in a standard file. And if you learn, even though somebody is indicated they don't have a disability, if you learn or suspect that they have a disability, you still shouldn't ask outright, do you have a disability necessarily? Instead, a safer way to go about that would be to indicate or to offer if somebody would like access to accommodations. because the accommodations should be available to everybody. As a matter of fact, you should offer accommodations to everybody, but certainly if you suspect, or it seems like the customer you're working with is having a difficult time interacting with or receiving or making use of services or resources that you are offering, you can offer alternative ways to ensure that those materials can reach them as well.
Yeah, thanks, Caleb. On the we have about 10 minutes left, so we want to make sure that we give you some space if there are any questions.
I don't have a question, but just a couple little add-ons.
Yeah.
I think like as you work with people that you either suspect have a disability or know have a disability, just kind of keeping in mind using person first language. So making sure that you're just look it up. It's easy to find info on it if you haven't already received any training on it. It's super simple. It's just really looking at making sure that you're addressing the individual as a person first and foremost, and you're not addressing their disability specifically, and being respectful in communication. And then another thing that sometimes comes up is if someone does have a communication barrier specifically, just really, doing what you need to do to not rush people and to be, using active listening throughout your interaction with them, even though sometimes it can get confusing, or it can be a little bit. I think that's with anyone. Sometimes you have a lot of things to get to, so that can sometimes be a little not frustrating, but it's just a reminder, I guess. Sometimes we try to rush people, and I'm guilty of it too. Everybody needs to do better in that regard.
Thanks, Jen. And I would just, since we have you here, if there's anything else that you want to share about any services that you want any of the staff here to be aware of that DVR has to offer, or any other information you want to share?
I think I'm not so sure. I think that you covered quite a bit in here. I think a lot of as far as the order of selection, or because DVR has a wait list, but currently right now in the state of Wisconsin, we're serving category 1 and 2 right away, and we're doing really regular activations of category 3 individuals. So right now we're in a position where folks are getting served that are found eligible for our services. I think that some of the services that were referenced there throughout the presentation today, someone working with DVR is eligible for services potentially. When we work with consumers, that's what we call our participants, as consumers. We're going to have an individualized plan for employment that's developed with them. So the services that are authorized for those individuals are specific to their needs and their disability barriers, and what they need to be prepared for the career of their choice that has been agreed upon. So not everyone is eligible for all services that we offer, but we do have a lot of different things we can assist with. So it would be a whole other thing to kind of get into the details on what we can offer. But really, I think we definitely, I think that's the one thing to just keep in mind, is that we're individualized, right? So just because one person gets it, it might not be applicable to another person's journey. And so that can sometimes get a little confusing for people that don't work in VR, consumers and referrers alike. But if anyone has any questions, you can always email me, or I can share my contact information too.
Yeah, thanks. If you can drop your email in the chat, that way people have, if they have additional questions for you, that would be great. And just want to open up if there's any other questions or comments before we close out.
One thing I wanted to say was on Monday we had a training on limited English proficiency, and one of the takeaways that I took from the training that I thought was really valuable is the refusal of interpretation services. So that also would go for individuals. You know, if somebody has their own interpreter, whether that's American Sign Language or another language, and they want to provide that interpreter, that is fine that they can do that. But we also, as service providers, have the right, if we feel like we need to have an interpreter to make sure that our message is getting across, especially if it's working with eligibility information, that especially if somebody is, maybe they're not, they turn out that they're not eligible, it might be beneficial for us to have our own interpreter to make sure that that message is getting across. If we don't know who that other interpreter is, if that's not somebody that we've contracted with or provided. So it's important to remember that.
Yeah, thanks, Carrie. Okay, last chance. Anyone has any other thoughts to share? Okay, so we will go ahead and close out. I do want to share some information. Just once you get the materials, you'll be able to click on this, but the Lead Center, if you have, if you want to look at some more information, that's available at the Lead Center. And also we did have 2 individuals from the state that were going to attend and they were not able to, but they did want me to share an email address if there are any questions that would be helpful if you had someone from the state answer. I'm going to go ahead and put that in the chat. So feel free to email with any questions that you might have. And then here's just some other ways to connect with the Lead Center through social media, either Facebook, Twitter, LinkedIn, or YouTube. And then again, just want to thank everybody for taking the time. I know 2 trainings in a week can be a lot, but we really appreciate you taking the time to come today. And we will make sure that we get materials out to you all soon. Thanks, everyone.